Dr. Crystal Murcia for Contemporary Pediatrics. Today I'll be speaking with Dr. David Klein regarding techniques for psychosocial interviewing of adolescents. Dr. Klein is a major in the Air Force Medical Corps and an adolescent medicine fellow in the Department of Pediatrics at Brooke Army Medical Center. Dr. Klein, why is assessing psychosocial history important for adolescent health?
Thanks so much for having me, Dr. Murcia. That's a great question. I think that I want to point out that adolescence is a time of growth and development, and for most adolescents, not all, when problems arise, they arise from issues related to behaviors and experimentation. So providers who choose to place more emphasis on the physical exam or with significant time pressure who fail to go into a detailed psychosocial assessment of patients may miss the boat, unfortunately, and not discover some of the major risk behaviors that affect adolescents' lives, and also fail to identify the strengths that the adolescents have, which help them to succeed in life.
So you advocate use of the HEEADSSS methodology. What exactly does this entail?
Right, the HEEADSSS assessment is a tried and true method. It was first published in Contemporary Pediatrics in 1988 with one of my co-authors on the newer paper, Dr. Goldenring. And it's a method that systematically looks at different dimensions of an adolescent's life where strengths and weaknesses can be easily found. And it starts with H, which would be home, and then it proceeds to E, which stands for employment or education, where adolescents spend most of their time, moves there to eating, and then activities, which is the A, where adolescents spend a lot of their free time. It moves on from there to a couple more sensitive subjects for certain teenagers, which includes drugs, which also encompasses tobacco use and alcohol use. And then from there proceeds to the three S's, one of which is suicidality, which we don't really typically refer to as that, but is also encompassing all of emotions, including depression, anxiety, and sexuality, which for a lot of teenagers can be a stressful topic to talk about, but not specifically sexual behaviors, but sexuality in general, which is sometimes a struggle for certain teenagers, and then moves on to safety, where we tidy up the interview at the end. Now, I just want to point out that it's important, not every interview needs to identify every single letter of HEEADSSS and keep it in that exact order. Sometimes it's more stressful at home for certain patients than even talking about sexuality, so it's important to engage with your audience and find out exactly how you want to run each interview. The acronym is more of a reminder to make sure you hit all of the dimensions that you're able to in the time.
So there's been a revision to the HEEADSSS methodology. What has changed in this most recent iteration?
Right, thank you so much for asking that. I think that the biggest change has to do with media use in adolescents' lives. Pretty much every adolescent since the last revision of this article in 2004 adolescents have access to the internet, to all kinds of media. And sometimes that influence is a bad influence. Other times it's a good influence. We can not only, in every different letter of the HEEADSSS exam, we don't always have to ask media questions for every, but it's a good idea to get a sense of adolescents' media exposure, and we give tricks to how to do that in the new article. And for example, sometimes media is a great way to connect to teens. You can use, if a teen, for example, is playing World of Warcraft regularly, we can say, well, have you made new friends with that? And then kind of proceed to how much time is it really taking from their life and whatever else. Two other quick changes I want to mention. One is Dr. Ginsburg out of Children's Hospital of Philadelphia has been a key proponent of incorporating the strengths-based approach to adolescent health, especially in psychosocial interviewing, and that is absolutely important. Something that we didn't talk so much about in HEEADSSS in the past. And it basically means, why don't you also ask the adolescent, what are you proud of? As for example, there's a lot of different ways to do this. And then in each of the different dimensions and each of the different letters, look for areas of strength and resilience, and then use that, because as risks come up, you can use what you found. For example, if an adolescent is proud of their running time, but have been failing school and have been engaging in other high-risk behavior, you can use that example to help them build their own creative solutions using running maybe as a way to mitigate stress. And then thirdly, we also know more about connectedness, the concept of connectedness, with a lot of studies that have been out there more recently. So adolescents who are more connected to different environments tend to do better as another way to look for resiliency in teens. So all of those different concepts are emphasized much more in this version of HEADS. And I think other acronyms that are out there right now, for example, the SHADES acronym, which is wonderful, incorporates some of this. But for some clinicians and clinics who choose to use the HEADS exam, it's absolutely fundamental to incorporate those principles in the psychosocial interview.
At what age or stage of development do you typically begin implementing HEADS, and how often are patients reevaluated?
Right. HEADS, it's very difficult to tell an exact age to start. We normally recommend when we feel like an adolescent is displaying the psychosocial changes that we would find in puberty, and sometimes that's in late elementary school. Other times it's not until the end of middle school, but it's more on a case-by-case basis, and it's something that the clinician has to astutely assess kind of at the time of the visit. I would, with today's times, I would probably err on the side of starting a little bit earlier. And if you get the sense that the adolescent is not ready for certain questioning, it's okay not to complete the psychosocial assessment in its entirety. But if you are limited on time, I think that the most important aspect to focus on is stress. Not all teenagers are ready to admit that they're depressed or are dealing with high-risk sexual behavior or spending all of their time online doing things that are less than productive. If you ask an adolescent at any visit, even if it's just for a cough or cold and you're running out of time, just wanted to give you a couple minutes of private time. We talk about how to do this in the article. Are there any new stresses in your life? Just to let you know, we're here to help you. We're here to support you. This is a safe place to come. Sometimes that's all you have to do, and the adolescent will open up. But looking at also at how they're doing in school or where they work, where they spend a lot of their time, it's great to assess that dimension as well, in addition to stress. And just to finish with that concept, I always do a routine, systematic depression screen for all of my visits, and it takes a very short amount of time, and it's described in the article, just to make sure I'm not missing anything. But on routine visits, preventative healthcare visits, or whenever I just have a lot of time, I try to do a thorough HEADS exam if possible.
Well, thank you so much, Dr. Klein, for joining me today. This has been Crystal Garcia for Contemporary Pediatrics.